Okay, we are here today and we're going to do a health assessment on this young man. Can you give me your initials?
TF.
Okay, and what's your date of birth?
8198.
And where were you born?
Forsyth Hospital
In
North Carolina.
North Carolina. Okay. And are you in a relationship at all right now?
Yes.
Okay. And what's your race?
African American.
Okay. And who is your your previous doctor before now?
Dr. K.
Okay. And why are you seeking care today?
Health assessment.
Just a health assessment. Okay. And what's your language?
English.
Okay. I'm going to ask you some questions about your vaccines. So you've had a tetanus shot before in '96. Okay. You've not had hepatitis shots. And how about flu?
Yeah.
And when did you have your flu shot?
12/13.
Okay. And when did you have your pneumonia?
12/13.
Okay. And you have had a chickenpox shot and you've had a MMR shot. Okay. When was the last time that you have been seen by a doctor?
October 15th.
Okay. And have you ever been in an accident or had any injuries before?
Yeah, I've been in one dirt bike accident.
Okay, and what happened there?
I had to get stitches in my eye.
Okay. And do you have any other medical problems I need to know of?
Severe asthma.
Severe asthma. Okay. So you haven't had any surgeries before? No, but have you ever been hospitalized?
Yeah.
Okay, and can you tell me about your hospitalizations?
I was intubated in 2010.
Intubated?
Yeah.
Why were you intubated in 2010 for?
Asthma.
For your asthma, okay. And all the other times you've been hospitalized, are they all for asthma?
Yeah.
Okay. So you've never been hospitalized for anything but asthma. Okay. Have you ever had to have blood products?
No.
Okay. Can you tell me what medications you're on?
Singular, Dulera, Flonase, Promep, I don't know how to say that.
Omeprazole?
Yeah, Omeprazole,
Okay.
Zyrtec, and Albuterol.
Okay. And do you take those medicines the way that you're supposed to?
Yeah.
Yeah. Okay. Do you exercise at all, or do you play any sports? Are you active?
I play soccer.
You play soccer. Okay. Do you play all the time, year round, or?
Yeah.
Yeah. Okay. So let's talk about your diet a little bit. How's your diet?
I'm not on a diet.
You're not on a diet, but what do you eat? Do you drink a lot of soda? Yeah. How many sodas do you drink a day?
4.
4 sodas a day. Do you think you eat a lot of salt?
Yeah, probably.
Yeah, probably. Okay. Do you drink alcohol at all?
No.
Okay. So you've never had any alcohol before?
No.
Okay. Do you use tobacco at all?
No.
Okay. Do you or have you currently used any recreational drugs?
No.
No? Okay. So you've never used any street drugs or used any kind of needles for street drugs? No. Okay. Are you sexually active?
No.
Okay. Trying to see what's next. Do you have any problems with frequent falls?
No.
No. Any vision or hearing loss?
No.
Do you know what advanced directives are, living wills are? No. Okay. So do you want any information about those today? No. Okay. So let's talk about some of your family history, okay?
All right.
So how old is your dad?
37.
37. Does he have any medical disorders?
No.
Okay. Does your mother, how old's your mother?
37.
Does she have any medical disorders? Okay. And any siblings?
I have one brother and one sister.
Okay. Do they have any medical problems?
No.
Not that you know of. Okay. How about your mom's your grandmother on your mom's side? How old is she?
She's 57.
Yeah.
And
Does she have any medical disorders that you know of?
not that I know of.
Okay. And your grandfather on your mom's side?
He's deceased.
He's deceased. Okay, do you know what happened to him?
Diabetes, and I think that's all.
Okay. And how about your grandmother on your dad's side?
Deceased, and liver failure.
Okay. And how about your grandfather on your dad's side?
Deceased, and
Do you have
clot.
cancers?
Cancer.
Okay. Um, so do you know what kind of cancer he had?
No.
No? Okay. Um, do you have any problems with stress or anxiety?
No.
No? Okay. Have you ever felt depressed?
No.
Do you get panic when you feel stressed?
Mm-mm.
No. Okay. Do you have any problems with eating or your appetite?
No.
No. Do you cry frequently?
No.
Have you ever had any thoughts of suicide?
No.
And have you ever thought about hurting yourself?
No.
Do you have any trouble sleeping?
No.
No. Have you ever been to a counselor?
No.
No. Okay. So let's see. Do you have any problems getting up in the middle of the night to use the bathroom?
No.
No. Do you have any pain with urination?
No.
Have you ever had any problems with your kidneys or bladder or prostate infection, any infections like
No.
that? No. Okay. Let's see. Now we're just going to do like a review of all your body systems. So you just tell me if you got any problems with those or not. Okay. So the first is your skin. Do you have any problems with your skin, like dry skin, or
No.
you don't have any dry skin problems? Okay. Do you have any problems with your hair or your head? Do you have headaches or problems with your head?
Yeah.
So you do have headaches. Have you started having, like, what kind of headaches are they?
Migraines.
Okay, can you describe your migraine for me? What happens when you have one?
When the light gets around me, like, my head starts to
Throb. Okay. All right. Do you have any problems with your vision or hearing? No. And do you have problems with your nose and sinuses, like runny nose or
Yeah, sometimes.
sometimes have a runny nose?
Yeah.
Is that with your allergies, probably?
Yeah.
Okay. How about your mouth or throat? Do you ever have any problems with your throat itching or burning?
Itching sometimes.
Throat itchy. Okay. And how about your mouth? Do you ever have any like sores in your mouth or no? Okay. How about your respiratory system? Do you have? How do you? You told me you had asthma. So how does that feel? Or do you have? Can you tell that you're wheezing all the time, or
No.
do you? How often do you use your inhaler?
Every day.
Every day. About how many times a day?
Twice, 2 or 3 times.
2 or 3 times a day. Okay. And have you ever had any problems with cardiovascular system, like your heart, or anything feels funny, or any rhythms, or any? Okay. How about your legs, like any circulation in your legs or your arms? You're feeling numbness or tingling, or no? Okay. How about your stomach? Do you ever have an upset stomach or your stomach hurts? Yeah. Okay. Is that what one of your medications is for your stomach? Yeah. Okay. Do you have any problems going to the bathroom with like urination or?
No.
No. Okay. Let's talk about your musculoskeletal system. Now, what that is your muscles and your bones. Do you have any problems with your muscles or bones ever?
No.
Or any pain? Any?
Actually, in my lower back.
Lower back, you have some pain. Okay. How about your neurologic system, which is your brain, your nerves, and do you have any problems there? Okay. And how about have you ever been told that you were anemic, or you have any blood issues, or sickle cell anemia, or anything like that? No. Okay. And your endocrine system, do you have any problems with diabetes? Anybody ever said anything like that? No. Okay. All right. Well, I think that is the end of your health assessment. Is there any questions that you have?
No.
No, do you feel like your asthma's managed pretty good? How have you been doing with it?
I've been taking my medicine regularly, not missing them.
Not missing any of your
So
medicine?
yeah, it's been a lot better.
A lot better. How long do you think you've been taking your medicine a lot better?
Um, since my last hospitalization,
Do you remember when the last time you was in the hospital?
October 16th or 15th.
Okay. All right. Well, thank you, and thanks for answering all my questions, and I will see you later.